Hello, today we're going to be talking about the benefit of oral care protocols for patients with dysphagia. About every 1 in 25 adults in the US will experience difficulties with swallowing. This was data collected in 2014. Further complications of dysphagia can lead to dehydration, malnutrition, and one that we really want to watch out for, which is aspiration pneumonia, which can lead to death. As SLPs, we can provide intervention through treatment of compensatory strategies and diet modifications, but also through prevention, preventative care. This can be done through patient education and our topic for today, which is oral hygiene care. Uterum UK in 2020 note that appropriate diagnosis of dysphagia, in addition to the implementation of preventative measures, is imperative to reduce the risk of AP aspiration pneumonia. So this goes to show we not only need direct treatment, but we also need that preventative care to contribute to positive patient outcomes. We're going to be reviewing 3 research articles today, and the first one's looking at the importance of oral hygiene care. So this was studying nursing home residents. They implemented oral care protocol, and they also reviewed the oral microbiome growth that can increase the risk of poor oral health. Now, it's interesting to review the oral bacteria because, as you know, if we are not brushing our teeth, if we're not keeping up with oral hygiene, we're going to develop bacteria, plaque on our teeth. It can lead to dental decay, oral infections. But the big one is that as we're eating and swallowing, that bacteria can travel down, and there's potential risk that it'll fall into our airway, further leading to other respiratory complications or aspiration pneumonia. Now, this is also a big topic for healthcare providers because research that was searching health trends from 2002 and on found that over the past 11 years, the LOS, length of stay, has slightly decreased in hospitals, but the cost for hospitalization has almost doubled. And a big contributing factor to this can be through acquired infections, which is something that we want to decrease, and we can do that through preventative care. Now, the findings from that article was that they did see that oral hygiene improved with no coughing or wet-sounding speech noted upon conclusions of the mouth care interactions. So that goes to show that it was safe to provide oral care protocols. Now, this doesn't decrease our risk and say we can provide it to every patient, which we're going to explore shortly, but we are able to provide oral care protocols and tailor it to our patients' needs, and it is safe and it shows that it is beneficial to them. Now we're going to review a research study that found success in implementing oral care protocols, and this was for an acute care hospital. So their aims were to identify some practices, develop a hospital-wide protocol, implement staff training so everyone was aware and understood the protocol, and ultimately reduce the incidences of hospital-acquired aspiration pneumonia. So here's where we're going to kind of touch on how we can provide good oral care to our patients depending on their situation. So the Oral Care Task Force, which was implemented in this acute care hospital, they provided education and guidelines based on dependency and acuity of their patients. So this chart goes from showing the patient's risk level from low to high to the level of protocol if they're general admission or if they're dependent on a ventilator. And then on the far right, it's going to tell you the method of protocol that would be appropriate for oral care. And this was something that they implemented in their hospital for their patients, and they educated everybody who was providing oral care on how to know which patient fall under which level and what method of protocol was appropriate. And ultimately, the big result that they see a decrease in hospital-acquired aspiration pneumonia. At the end of Q4 in 2017, they're at 6.2. By 2018, they're at 4.7. So there wasn't a full-on decrease, but there did see a decrease in numbers overall. And that was really great to see that in direct implementation with strict protocols and interprofessional collaboration, they were able to see some change. The last article we're going to look at is reviewing nurses' knowledge behind the provisions of oral care. So through surveys, the authors found that the RNs reported a lack of knowledge of the relationship between oral hygiene, dysphagia, and pneumonia. So this specific article, along with the ones we've been reviewing, call for interprofessional collaboration. Professionals are providing oral care provisions, but we are finding gaps in their understanding of why it's essential. So as professionals, if we have the knowledge, we must share and we must help others to understand it so that we can see those positive patient outcomes and also positive interactions with our other professionals. And here are my references.